Today, I will talking about Huntington's disease to review the pathogenesis and the new therapeutic approach. Huntington's disease is a progressive brain disorder that causes uncontrolled movement, emotion problem, and loss of thinking ability. It usually appears between the age of 30 and 40. Early symptoms like dispersion, small involuntary movement, difficult learning new information, or making decisions. As the disease progresses, the parent may have difficult walking, speaking. People with the disorder also experience personality change and decline their ability to thinking and reading. Many people with Huntington's has involuntary conversion movement as known in Korea. People with Huntington disease who develop at home living 15 to 20 years after one set of symptoms. It also have movement problem and mental and emotion change. So what causes Huntington's disease? Nutrition in the HTT genes cause Huntington disease. The HTT genes the instruction of making a protein called Huntington's. The protein appears to play an important role in nervous cells in the brain. An increase in the size of CAG segments results in abnormal elongation of Huntington's protein. The protein will cut into smaller toxin fragments together and in nerves will broken the normal function of another cells. An autosomal dominant protein of inheritance in which effect person usually inherit the gene from the effect parent. If the parent have 40 to 50 CAG duplicated in the HTT gene, the children will have more than 16. Huntington disease affects estimated 3 to 7 per 1 million people of Europe. The disorder appears to be less common in some countries, including Japan, China, and Africa. Genetic testing of MHTT mutation can be negative and predictive. If the fitness carry in large CAG, we can use prenatal diagnosis and determination of pregnancies. Huntington's disease cannot be reversed or cured, but treatment and support can enable patients to learn healthy life, like medication to relieve mood change, medical treatment for cough. Drug also can reduce some problem caused by Huntington's disease, but they cannot to stop or slow Huntington's. Target the DNA or RNA of the MHTT genes to lower MHTT level in animal model. HTT mRNA level will reduce up to the 80%. A large number of signatures will still need before they can use on the patient. A new compound T111 is isolated for Chinese hybrids. Animal model has shown that T111 enters the brain and increase CAMP through the activation of A2AR in the body. Most important is in promoting coordination, increase protease activities. T111 also can increase level of important neurotropic factor in the brain. This results showing that prevention of T111 can treat Huntington disease and also can learn to develop of new drug for another disease. The down function of T111 able T111 to effectively delay the progression of HD. This is a normal treatment stage of HD. The trait of not yet in clinical trace, but it does suggest treatment options. HD affect individuals of different age, making it difficult to predict the age of one set of the disease. Scientists are focusing on identify and study focus, accelerate and delay on one set of the disease, even by symptoms begin.